Now we're going to get down to the nitty-gritty of what Indians are all about.
I still say we Indian people are believers in the truth. This is the way of life that was given to your people. You're born an Indian, you're going to die an Indian. Indianness is a good life. You're facing an Indian this afternoon.
Good Saturday afternoon out there, everyone, and welcome to your number one source for Native American television news, Native News Today. I'm your host, Jason Salzman, from the Mvskoke Media Studios, as we are getting ready for our show this week. Lots of great things to share with you. Can't wait to get to our features today. Lots of wonderful content coming up. Lots of things out there on MvskokeMedia.com. Definitely stay up with our website. It's been going strong since the beginning of the year. We sort of rebooted everything and got lots of content on there each week. And you're getting things coupled with a written story for the newspaper, the Mvskoke Nation News, coupled with videos from us. So you're getting a little bit of everything there. And also there's archives of the radio show with Gary Fife. A little bit of everything on MvskokeMedia.com. So make sure that you're checking us out each day. That's one of your stops. I know everybody out there likes to sort of get on the internet and run around the news sites, kind of like back in the old days, it's open in the newspaper. But you go to your different sites. Make sure Mvskoke Media is bookmarked in one of your sites every morning, because you got to see what we're covering every day. And keeping on the internet, keeping on our sites that we have, our social media sites, our Facebook page, we're growing by the day with all of our people that are following us, liking us, checking out our content on there. And the reason I bring that up is something I shared earlier today. I'm sharing not only things that we are doing, but national news as well. It's an interesting story that I shared today. The National Archives, for the first time on display, has the actual Indian Removal Act, the literature, the signatures, everything of the Indian Removal Act. I thought that was pretty neat. So that's the kind of things that you're going to see on our website. It just keeps you connected to national Native news as well. So you get a little bit of a well-rounded coverage of what's going on in Indian country, not just here in the boundaries of the Mvskoke Creek Nation or in Oklahoma, but abroad and nationwide as well. So a lot of great content on there, but as I said, lots of great content on the show this week. We're about to get started. We're going to take a quick break here in just a minute, but we have an all-new look at the all-new Mvskoke Creek Nation Medical Facility going up in Okemah. It's almost done. We talk with the Secretary of Health, getting basically an update on the health department as a whole as we go and look into that new building. And we got some other stuff coming up for you as well. But we're going to get to all of that after this first break. Don't go anywhere. You're watching Native News Today. And welcome back into Native News Today as we get ready to start off our features for this week. And our main story this week takes us to Okemah, Oklahoma, where, as if you've been following the Mvskoke Creek Nation, you know that our newest health facility going up there right along I-40. I know a lot of traffic goes that way to and from Oklahoma City, down I-40 there. And you have had to have seen the facility, the new hospital going up, and it's very impressive, very neat looking, and especially on the inside. We got an inside look at it here at Mvskoke Media, Native News Today specifically. Devaney Luxinger and Jessica McBride went over there this past week and talked with Sean Terry, the Secretary of Health at Mvskoke Creek Nation, not only to give you, our viewers and the citizens out there, a look into the new facility at Okemah, but also an update. It's been about a year since we've done some coverage, full coverage on the problems that were happening and things at the health department. Now here's an update and an inside look at the newest facility.
We've pushed really hard this year. We've had a great year of stabilizing our finances. We've really focused a lot on facility improvement this year. If you go down to Eufaula, you see the old clinic has been painted and rejuvenated. We've got steel coming up out of the ground with a new facility, so we're about 18 months from having a brand new 70,000 square foot new facility in Eufaula. The Okmulgee Hospital is much cleaner today. If you go in, the floors all look really clean. The kitchens are all really clean. The financial status is stabilizing there. We just passed our state inspection over at the rehab hospital, so we're really excited about that. We've got, of course, this new facility happening in Okemah that we're going to have open by the end of the year, so extremely excited there. Potentially hundreds between the two facilities. Very quickly, we're going to have to start thinking about additional housekeepers and caretakers and ancillary staff here at Okemah. We probably won't grow as fast here. It'll be kind of a staging process as we grow into the building, but just the size of the campus is going to require a lot of extra housekeepers and caretakers. The Eufaula Clinic, we will start next year, and it'll be significant hiring there. Well, we're really focused on trying to improve access. We want patients to be able to get in and to get care quickly. And so just the operational efficiency of that, simple things like answering the phones and the new phone systems that we're bringing in, the quality of care. We're talking to some really good doctors that we hope to bring on board into the medical staff, and so we're excited. And we've got a lot of ideas about expanding hours into after hours or weekends that we might be trying to pilot some just to see if we can't expand care a little bit. Well, we want them to be engaged. We've really been out in the communities promoting our Together We Can Do More campaign. And this is not just about our operation. This is about everybody in the Mvskoke Nation be involved to make their health system better. So whether it is enrolling in Medicare or Medicaid and letting us help them get enrolled in the insurance plan, communication back to us on how they're doing. It takes everyone's effort to make the system better, and so we want our citizens to be engaged in helping us do that. The reality is that Indian Health is not an entitlement program in the federal budget like the VA or Medicare. It's a discretionary spending. So if you ever watch the TV and you see a politician say, we're going to cut discretionary spending by 10%, Indian Health Service goes into that bucket of spending. So it's always vulnerable. So by law, by federal law, we are required to bill Medicare and Medicaid and private insurance to supplement our budget. So not only is it not detrimental, it's imperative that we do better, because I don't see the government ever doing more to try to build our health care. It's going to take the tribe to solve its own problems, and that's how we're going to do it.
The National Council action in April was to extend the loan at no cost to the nation. So there's no fees, no additional money we had to loan. We're under budget. But the time of the loan would have ended in June 30th. And so the bank allowed us to do a 6-month no-cost extension just so that we could get everything opened. And so council passed it on Saturday. I signed it on Saturday, and so this week they're finishing the paperwork on that. Well, the hospital construction is pretty much online in terms of our schedule. The road is out nearby. We recently we encountered a lot of right-of-way issues we had to deal with, so that set us back more than anything else. And so to make sure that the hospital opens on time and that the road gets finished, we needed to extend that contract. During our administration, and with my background in healthcare, one of the first things we wanted to look at was this facility here. There were opportunities, and there were opportunities to re-engineer things to save cost and to improve quality. And so we've been able to do that. If you look at some of the lighting, we changed the lighting so that we use lower power but brighter lights. We re-engineered some of the outside appearances to either add glass or take some glass away because it would bring in heat, so it cost us more to cool. And so we just kind of fine-tuned things the way we felt that we needed to. There were some issues of placement, so we modified the floor plan to accommodate better efficiency, and then basically turned that over to the contractors. We did change the prime contractor. Manhattan's now the prime here, and we felt we needed to do that for just their experience and their ability to manage multiple subcontractors. And it's worked out well. We're on time, we're on budget, and we're almost through. So what you've seen today is we're probably about the 95th percentile in terms of completion. A number of the people who were laid off in September have already been reemployed. Some of the people that we kept left, so we used some of those people to come back. The exact number I don't know. We'll continue to do that, and because those people, the staff that we lost, those individuals are valuable to us. So if we can work them in, we will work them in, and we'll continue to do that here. You follow whatever is available. Well, now that we have, the Secretary of Health in place, the monthly operational reports is going to be vital. So that will look at not only the financial side, but also the quality side, workload side, and we need to look at that frequently to gauge what needs to be moved. Where in terms of the tribal healthcare system, we're a fairly large healthcare system. 2 hospitals, 9 outpatient clinics. We got a lot of moving parts for our citizens. So we just want to make sure things are coordinated, they're done efficiently, we make sure that we guarantee the quality, and that takes continuous review. And so we've got that in place, and I think that what we will do is just continue to fine-tune that as we go along. That hopefully they already see that it's being responsive. With the technological advances that we have as well, they should see much more ease in getting appointments, shorter times waiting when they arrive at the facility, better technology and diagnostics. And what I want them to see is that translates into being seen quicker, getting good care, and then being able to go back home, because that means a lot to them. They like the place, but they don't want to spend the whole day here, and we don't want them either, because we don't want them to catch anything from any other patient. So we will come in, have them come in, treat them, and let them go home. And I think we'll see a lot of improvement. We check a lot of factors regarding, reinfection rates or infection rates, readmission rates to hospitals if they are discharged from here, just to make sure that we're doing things to keep them at home and keeping them healthy. Well, I think what the citizens, maybe they won't see, but the thing that I think is important is the fact that we're using geothermal, so we're using the Earth's own energy to heat and cool this facility. We're using a lot of lighting in a way that saves money, but also provides a view of the land. You see the design of you see the names of all the clans of the tribe, and to me, even the woodworking and the colors and all, I think it's going to be something that would put them at ease, make them feel comfortable coming to our facilities, and especially here in Okemah. And I think that will be well received by our citizens.
And we want to thank Sean Terry again from the Health Department, the Secretary of Health there, for giving us a few moments of his time there that day and giving us an inside look at some of the construction, some of the finishing touches being put on the Mvskoke Creek Nation Health Facility there in Okemah. We'll have updates for you on that facility and its opening as they become available to us here at Mvskoke Media. We'll have them to you on the show here as well as the website. Well, moving right along, one of the things that it will probably have lots of in that facility is medication, and that's something that a lot of people out there have in their cabinets, in their homes. Sometimes that medication is out of date, needs to be disposed of, and that medication in many cases can cause a lot of problems. It gets into the wrong hands, people that get it, or kids, anything like that. So the Behavioral Health Department had a drug drop-off event to bring and safely discard of your medications in awareness of prescription drug abuse, things like that, and we talked with them about this event.
Today we're out here celebrating the prescription drug take-back events. We're partnering with Light Horse today. We will be out here from 10 to 2. Basically, anyone who has any prescription drugs that they need to get out of the house, whether they need to dispose of them properly or they're expired, we encourage them to come on out here to Light Horse Police Department and drop them off here. We'll be here till 2 o'clock with a drop box. Whenever we leave, we're actually going to have a permanent drop box here at the Light Horse Police Department that'll be here 24/7, 7 days a week. We know now that 18% of all completed suicides are actually related to prescription drug medication. So when we see that number, we believe that there's something we can do to reduce those means of suicide. And one of the ways we do that is by having events like this, bringing awareness, letting people know that if they have somebody in the house who may have access to those pills and they want to dispose of them properly, they can bring them here to Light Horse. We also do medication lock boxes that we provide to people who need them so they can lock up their medication safely and reduce the means of suicide in that regard. Also, last year we installed permanent lock boxes into the elderly housing there, so everyone there living in those facilities now have a permanent lock box so they can lock those up properly as well.
Prescription drug abuse, particularly here in the nation, is really on the upswing. It's easy to get a hold of. Usually someone who wants it can go to a relative's house. They're in a medicine cabinet or in their, in their bedroom drawers or wherever. So unfortunately, it's easy access and it's a quick and inexpensive high. A lot of times we have students who are experimenting. They see this drug, they heard about it, want to see what it will do to them, and unfortunately they either overdo it, really cause harm to themselves, or unfortunately sometimes they go too far and lose their life in taking these drugs because they don't know what they're going to do to them. So
one of the biggest programs that we do is a 1-hour training called QPR, that stands for Question, Persuade, and Refer. And what that training does is we come in and we host the training and we provide statistics on suicide, and we talk about how to talk about suicide. We talk about the verbiage that we use. We talk about the rates of suicide. And then we hop into the QPR portion where we talk about how to ask the question to somebody who may be suicidal and looking for warning signs and what to look for. Also how to persuade someone to stay alive and get help, and then the referral port, and that's where we come in and where we refer them to counseling services to get them professional help that they need. They can call us anytime. We're at 918-756-1910. We have a 24-hour number as well. We also have the crisis text line that we're very excited about. That's another resource out there available. You text the word CREEK to 741-741, and within minutes you're connected with a crisis response texter, and they can talk you through and also offer local resources to you from your area where you texted.
All right, and our thanks again to Tyler Stone there and everybody at Behavioral Health for the information, Light Horse as well, hosting the event. And just be cognizant of those things, folks. If you have some unneeded prescription drugs just laying around, they're sitting around, you just need to dispose of them, there's a 24-hour lockbox, as you saw there, at the Light Horse Police Department. Well, moving right along, one of the things that we are looking at in these months leading up to summer is there's a lot of these awareness days, awareness months, things like that. And this past week was a National Day to Prevent Teen Pregnancy. And what we did here at Mvskoke Creek Nation, and I say we, but meaning the Mvskoke Nation Youth Services Department, was holding really the kickoff of a series of events called We Need to Have a Talk. And basically, teen pregnancy, it's an issue with our kids. Sometimes it's tough for them to talk with their parents. This event that they had at the Mound Building covers these type of things. We were so glad to be able to be there and report on it.
Today we hosted a National Teen Pregnancy Prevention Awareness event at the Mvskoke Creek Nation Mound. So basically what we wanted to do was just kind of bring awareness to the Mvskoke Creek Nation and our communities about how prevalent this problem is here, not only in Oklahoma but also within the Mvskoke Creek Nation boundaries. We had a presentation. First we kind of talked about what parents can do as far as education, talked about what they can do communicating with their child. A lot of times parents, they tell their child, they don't communicate with them, but communication kind of takes back and forth. So we want to make sure that those conversations are actually going back and forth. But also another side of that is making sure that they're hearing from real life people that are in these situations. A lot of times that kind of hits home a lot better for a lot of youth. And so we brought a panel of current and former teen parents, and we had them just talk about kind of what that experience was like, talked about some of the challenges that they had, and it did get pretty emotional. Teen pregnancy is an emotional issue. It's a very sticky issue. I think that it's just hard for people to talk about, but it's something that needs to be talked about because we're #2 in the nation for teen pregnancies. And I talked about here in Mvskoke Creek Nation boundaries alone, our American Indian Alaska Native youth are getting pregnant. They make up 13% of the entire teen birth rate within the boundaries. And so that's a huge number whenever we're only making up 14% of the entire population. A lot of what Mvskoke Nation Youth Services do is we empower our Mvskoke youth, but a lot of parents have come to us and talked about how they also want the education and they want to know how to have these conversations with their youth. And I think that that's really empowering. That also goes along with empowering our Mvskoke youth is educating their parents so that they can have these conversations, they can have it at home, they have a better home life then. A lot of things impact that parent-child communication. And so we're wanting to start a We Need to Talk series. That We Need to Talk series will cover a range of subjects. We started today with, or we're starting this month with about teen pregnancy, but eventually we want to bring it about youth mental health, about teen substance abuse, about teen dating violence, just the different things that are affecting youth. And the series essentially has two components. It has a parent education component. So we go in and we talk to them, how do you talk to your child? Give them basic communication skills, and then we educate them about the issues that they're needing to talk to their child about. So we give them the actual factual information so that they can then go home and have that conversation with their child. On the flip side, the child is also learning how they can bring up these issues and these topics with their parents, and then they're also letting us know letting the parents know what they want to hear from them. And so at the end of the session, then we bring them all back together and we let the parents know exactly what their youth are wanting to know about those issues, so that then whenever they leave there, they can begin to have that conversation. They have a starting place and they've gotten the tools that they need to today.
And that'll do it for another episode of Native News Today. I want to thank all of you for watching us out there. We really appreciate everybody that watches. You know, I had a young man at Arvest Bank the other day. I was going through there just doing some business, and he said, "Hey, I know you," and I said, he said, "The show, right?" And I said, "Yes." And I said, "Do you watch?" And he goes, "No, but my grandma does." And I thought that was great, because we do. We appreciate the folks out there that watch us, from, you know, the older folks out there that watch and they get, you know, the things that they like to see about their tribe, about their health care, our Elder Conversation series. We have some more of that coming up soon, so be on the lookout for that. And old Terry Day over there, and I know he's a big fan of the show. He told me about it this week. So those people out there, you know, I really appreciate them watching each and every week, and no matter where you're at. So I want to thank them, and I want to remind you as well, we have a lot of big things coming up here, not just at Mvskoke Media, not just at Native News Today, but at the Mvskoke Creek Nation. As we get into those summer months, we know that June is right around the corner. That is festival time here in Okmulgee, and the Mvskoke Creek Nation Festival. Some big news I can pass along that we broke on MvskokeMedia.com this week. They have announced the headliners for the entertainment this year. Friday night it'll be Leanne Womack, and Saturday night be Kenny Wayne Shepherd. So we're going to have country night, blues night, and I believe Leanne Womack has an opening band with her, and then Kenny Wayne Shepherd, I believe, has Johnny Lang with him. So a lot of people out for those nights for the entertainment, and of course all the other great festival activities, the sports, the arts and crafts, the traditional games. It's going to be great, and we'll have more as time gets closer, including a look at the festival, how it works, what it costs the nation, who's working the festival, things like that, and inside look at its history as well. So we're excited about all that. We're going to bring that to you here on Mvskoke Media, so stay with us. We want to see those subscribers numbers continue to climb on our YouTube channel. A lot of people out there watching us on YouTube. We really appreciate that. It gets us to people outside of our viewing area, outside of our television viewing area. So that's a wonderful thing for us, and we put things up weekly on demand. You can watch them whenever you want to. Well, for Jared Moore and Devaney Luxinger, all the great people that make it happen here at Native News Today, I'm Jason Salzman. We'll see you next time.